Hello, everyone. Welcome back to the ICD-10 Wound Ulcer Management Diagnosis-Specific Coding Guidelines. We're very happy that you decided to join again, and we're going to talk about some parts of the coding book. We gave you lots of generalized examples the last time. This time, I'm going to talk to you specifically about diabetic ulcers and how you go about looking them up, and some of the coding instructions that are included in finding the correct code. So first, we talked about the different chapters that were in ICD-10-CM, and we, of course, are dealing with Chapter 4, which is Endocrine, Nutritional, and Metabolic Diseases, and that was categories in range E00 to E89. So this particular chapter, what I did below is give you the chapter ranges of code. So you can see that there's disorders of the thyroid, diabetes, other disorders of glucose regulation, disorders of endocrine glands, and so forth. So all of these three-digit categories are included in Chapter 4, beginning with those three characters. So when you begin to look these codes up, you're going to first turn to your alphabetic index. And the main term that we're going to look up at this point is diabetes. And you can see that there are some descriptors that are in parentheses next to the term diabetes in the alphabetic index. And it'll say type 2, type 1, there's other forms of diabetes and so forth. But underneath whichever diabetic type you have, there's going to be a series of subterms that are underneath it. And you can see amyotrophy, arthropathy, and so forth. But if you go all the way down, you'll see foot ulcer at E09.621. So that is actually where you're going to look in the alphabetic index to try to find these codes. And ultimately, you're going to go to type 2 diabetes with foot ulcer, which is E11.621, and you'll see that in the alphabetic index. And underneath that, you will find an instruction that says use additional code to identify the site of the ulcer. And that's going to be from category L97.4 to L97.429 or L97.5 to L97.529. So now we go to the fun part, the tabular index. So in the tabular index under type 2 diabetes, there are a bunch of code range notes. So that's at the beginning of this chapter or section of the tabular index. So basically what it says is that included with the type 2 diabetes code range, it includes diabetes due to insulin secretory problems, diabetes not otherwise specified, NOS, insulin resistance diabetes. And you'll also see another instruction underneath that when you go to that code that says use additional code to identify the control using, and they give you 4 options there: injectable, non-insulin anti-diabetic drug, insulin, oral anti-diabetic drugs, and oral hypoglycemic drugs. So you have an instruction there to use additional code to identify how the diabetes is being controlled. Also under there, you will find an excludes one note. And excludes one note means that it is not coded here. So if the patient record that you're trying to code has diabetes due to other underlying conditions, drug or chemical-induced diabetes, post-procedural diabetes, secondary diabetes, and so forth, it's telling you that you need to go to a different section in order to properly code that. So you can see like gestational diabetes sends you to an O24 chapter to indicate gestational diabetes, and that's found in the obstetrics and gynecology chapter. So under the tabular, you're going to find the non-pressure ulcer of heel and midfoot, and it's going to tell you to code first. Remember, we saw on the last slide, it instructed to use the L97 codes. So now we're in the L97 codes in the tabular, and it says to code first any underlying conditions. such as gangrene, atherosclerosis, chronic venous hypertension, diabetic ulcers, post-phlebitic syndrome, post-thrombotic syndrome, and varicose ulcer. And it will tell you that it includes chronic ulcer of the skin of lower limb, not otherwise specified, a non-healing ulcer of the skin, non-infected sinus of the skin, trophic ulcer, not otherwise specified, topical ulcer, not otherwise specified, and ulcer of skin of lower limb, not otherwise specified. However, we also have an excludes note under there that says if it is a pressure ulcer, you need to go to category L89 for pressure ulcers to look up your code. Or if it's a skin infection, it's going to L00 to L08, which would be your abscess, cellulitis, and so forth. And it also excludes specific infections that are classified to the infectious disease chapter A00 to B99. So then under the tabular, if you go to non-pressure chronic ulcer of the right heel and midfoot, you will see that there are plenty of subcategories, and you see the second set of 3 characters tells you about the severity of that ulcer. So you can see limited to breakdown of skin, with fat layer exposed, with necrosis of muscle, necrosis of bone, muscle involvement without evidence of necrosis, bone involvement without evidence of necrosis, and with other specified severity and with unspecified severity. Now, a word to the wise, please try to stay away from other specified severity and unspecified severity as best as you can, because the severity of the wound should be documented in the medical record, and you should always choose the most closest code to exactly what the condition is. So some of the terms that we just saw includes notes. If you're in the tabular and you see includes notes, that note appears immediately under a 3-character code title to further define or give examples of the content of the category. So in the alphabetic index, you may also find terms that are in parentheses that will indicate to you that you're in the right term and the other qualifying terms that are applicable to that main term. You'll also see inclusion terms. So that's a list of items that are included under some codes. These terms are the conditions for which that code is to be used. The terms may be synonyms of the code title, or in the case of quote unquote other specified codes, the terms are a list of the various conditions that are assigned to that particular code. So we saw an example of that in the previous lookup tools that I gave you for diabetic ulcer. We also had an example of the excludes one. The excludes one notes, it's a pure excludes note. It means that the condition you're trying to code is not coded here. And usually that note will indicate that it says if it is one of these other following categories, that you need to go elsewhere to find the correct code because it's in another category or in another chapter. An excludes one is used when 2 conditions cannot occur together, such as a congenital form versus an acquired form of the same condition. So for example, if you had an acquired condition, it would tell you that yes, the acquired condition is included here, but if it's congenital, then you need to go elsewhere in the congenital disorders chapter. Excludes 2 notes means that it's not included here. And excludes 2 note indicates that the condition excluded is not part of the condition that is represented by the code, but a patient may have both conditions at the same time. So when you have an excludes 2 note appear under a code, it's acceptable to use both of the codes and the excluded code together when it's appropriate. Now, a little bit about etiology and manifestation instructions. We saw code examples of code first, use additional code, and in diseases classified elsewhere notes. So basically, certain conditions have both an underlying etiology and multiple body system manifestations due to underlying etiologies. So for such conditions, the ICD-10 system has a coding instruction or convention that requires the underlying condition to be sequenced first. It becomes the first listed diagnoses when you go to bill the case. Whenever such a combination exists, there's also a use additional code note that instructs you to code first the etiology code, and then you will have the manifestation code. So these instructional notes indicate the proper sequencing order of these codes, the etiology followed by the manifestation. So in the diabetes example that we just did, the underlying diabetes will be coded first. So basically it's the diabetic code with its complication, diabetes with foot ulcer. And then the manifestation will be coded second. And the second code is going to be the actual non-pressure ulcer code that we discussed. And you will also determine the severity of that code. So basically a diabetic foot ulcer, in order to accurately describe it, is going to take two codes, one from the diabetes category and one from the non-pressure ulcer category. So that's two. And if you remember, in the head of the section for all of diabetes, it instructs you to use the method of control code, which is one of those Z codes, which is a status code that tells you that the patient is on specific types of drugs for control of that problem. You also saw the instruction use additional code. So when you looked up a diabetic ulcer, you saw a note that says use additional code at the etiology code and a code first note at the manifestation code. So when you were looking at the ulcer codes, it told you to code first, basically the underlying condition. So that means that needs to appear as the first listed code, and then the use additional code to describe the manifestation code. There are manifestation codes that do not have in diseases classified elsewhere in their titles. And for such codes, there is a use additional code note at the etiology code and a first code note at the manifestation code. And the rules for sequencing do apply there. In addition to the notes in the tabular list, these conditions also have specific alphabetic index entry structure. And we showed you an example of that for diabetes. And the instructions will tell you that both the underlying cause and the manifestation code will be next to it in brackets. So the code that's in the brackets will always be sequenced second. And we also saw when you were looking up in the alphabetic index, the term with. So and with are very important when you are looking at the coding instructions. The word and should be interpreted to mean either and or, quote unquote, or when it appears in a title. So it's just like when you're writing a sentence and you say and or. So the word with or in should be interpreted to mean associated with or due to when it appears in a code title in the alphabetic index or the tabular list. The classification presumes the causal relationship between the two conditions linked by these terms in the alphabetic and tabular index. These conditions should be coded as related even in the absence of provider documentation that explicitly links them, unless the documentation clearly states that the conditions are unrelated or when another guideline exists that specifically requires a documented linkage between the two conditions. So, for example, there's a sepsis guideline for acute organ dysfunction that is not clearly associated with sepsis, if you happen to look up that code. So for conditions not specifically linked by and or with in the classification, or when a guideline requires that a linkage between the two conditions be explicitly documented, the provider documentation must link the conditions in order to code them as related. So that's very important that as a provider, that you document if one of the conditions is a result or related to the underlying cause. And the word with usually appears right under the main term in the alphabetic index. and then all the subterms will be listed underneath it. You also saw a C and C also. The C instructions following the main term in the alphabetic index means that there's another term that should be referenced, and it's necessary to go to that main term referenced with a C note to locate the correct code. And a good example of that is laceration. You'll see a note that says C wound open. So that will give you another place to look for the code. A C also instruction in following the main term in the alphabetic index instructs that there is another main term that may also be referenced that may provide additional alphabetic index entries that may be useful. It's not necessary to follow the C also note when the original main term provides all the information for the necessary code selection. Code also is a note that instructs that two codes may be required to fully describe the condition. And a perfect example of that is what we just did with diabetic ulcer. That requires two codes at this point. But that note code also does not imply the sequencing direction. The sequencing depends on the circumstances of the encounter. And lastly, the code assignment and clinical criteria. I just wanted to note that the assignment of the diagnosis code is based on the provider's diagnostic statement that the condition exists. The provider's statement that the patient has a particular condition is sufficient. Code assignment is not based on clinical criteria used by the provider to establish the diagnosis. If there is conflicting medical record documentation, then you need to query the provider to gain the specificity that you need in order to code the appropriate code for that condition. So hopefully I gave you a good introduction to how to look up some of the terms and the instructions using the diabetes codes for diabetic foot ulcer. And this slide shows you the actual link to the current ICD-10-CM guidelines that went into effect on October 1st, 2024 for fiscal year 2025. So I wanted to thank you, and I wanted to invite you back for the next episode of the ICD-10-CM journey that we have started you on for the next episode. In addition, if you have any questions on this module, or should you want another topic covered specifically, please feel free to email Kathleen Sham, and she has her email address on the contact information, and we'll be happy to put something together or get back to you with an answer on your specific questions. So we appreciate the opportunity and are honored that you decided to join us today, and we look forward to seeing you during the next episode. Have a great day.